At Ageless Forever, we often get questions about growth hormone replacement therapy. We have a lot of patients that call with this in mind, that they're just going to come in and be prescribed growth hormone merely because they want it and they want to try it. Well, it can't be done that way, and there's reasons for that. First and foremost, the federal government regulates growth hormone. It's only allowed to be prescribed under federal regulations in 3 basic categories. One of them is pediatric growth hormone deficiencies. Well, since I'm not a pediatrician, I don't have to worry about that. The second is HIV/AIDS wasting. I do have some patients that have suffered with HIV and AIDS, and they are able to have growth hormone prescribed to them to treat that wasting syndrome that they're suffering from. The third category is where most individuals that are interested in growth hormone therapy would fall into, and this is adult onset growth hormone deficiency. If you have adult onset growth hormone deficiency, then we can prescribe growth hormone. In order to determine if you have growth hormone deficiency, we have to do some testing. First, we have to make sure that you do not have insulin resistance, because insulin and growth hormone are inversely proportional. If you have high insulin, we need to correct that to see if your body will produce growth hormone. If you have a relatively low testosterone level and you're a man, low testosterone and low growth hormone go hand in hand, and about 90% of guys, as we improve their testosterone, their growth hormone levels improve by themselves. Liver disease can also decrease not growth hormone, but its derivative, which is called IGF-1, insulin growth factor 1. This is what we measure. So first off, I have to ensure that you don't have anything going on that's putting the brakes on your natural production of growth hormone. If you do, we need to address those. Another issue that just came to mind would be sleep apnea. If you're not getting into the deeper stages of sleep, your body will not produce growth hormone effectively and efficiently. So those are the things that we need to address. Once we address those, if your growth hormone production seems still to be low and you're symptomatic, we then have to do a growth hormone stimulation test, which is a provocative test that we do here in the office. I'd be happy to explain that test with you once we get to that point. Unfortunately, growth hormone cannot be just prescribed because you want it. It cannot be prescribed for anti-aging purposes. The only legitimate reason that we can prescribe it is if you have documented adult onset growth hormone deficiency. If you suffer from any of these symptoms, or you're concerned that your testosterone level may be low, please give us a call. We'd be happy to help you. We look forward to seeing you.